Hi, Arthritis Warriors. This is Dr. Joff. I'm sorry I haven't been back in a while. It's been really busy. But today we are going to talk about this thing here. What is this thing? It's actually a massage gun. You use this particularly for patients who have muscular problems. The massage gun, as the name implies, it's a massager. And in general, if you are asking, pwede ba magpamasahe? Does massage work for arthritis? It really will help if you have very tight muscles and if you want to loosen up these muscles. You don't want to have a massage like every day of the week. You don't want to use the massage gun every day because you will end up na mabunog or you will have muscles that are relatively contused. Mabunog ang muscles and then you will have more pain than usual. I've had this one patient, he had super tight muscles and it was around his upper thigh and hip joint, and he did not know that this was a muscle problem. He went to a gastro, he went to internists who could not diagnose the problem. He even had an MRI done. So what did I do? How did I know that it was a muscle? I actually did a physical examination, actually moved and palpated the muscle, and I found that there were taut bands. Kanang giingon nila na murag lamig-lamig. Taut bands are those lamig-lamig. Maybe you feel them as knots in the muscle. A lot of the masahista will find this in the back when they're massaging your back. It can be any muscle that can have taut bands or knots. And these things are very useful if you want to have these taut bands released or needed. Because the muscles, if they lose flexibility or pliability, when we are young kasi, this concept of flexibility or pliability of the muscles means that the muscles are able to be strong but also at the same time are very elastic, and the term is pliability or flexibility of these muscles. That will mean that if you are very pliable, you can be very strong and at the same time resist a lot of injuries. Later in life, if you have very tight muscles, it can worsen these areas of the body where you already have pain. If you have arthritis around the hips, arthritis around the knees, if you have really tight muscles, sobrang sakit. You can have these parts of the body checked by just palpating that part of the body. If you have taut bands around it, if you have these knots around the muscle, that is where massage can help. And of course, the massage can help. But do not overdo it because these things, these machines can be very powerful. It can indeed release all those knots and taut bands, but they can also injure you long term. This actually happened to that same patient who had a taut band or muscle knot around his hip. He kept on going for massages because when he realized that it was a muscle and massage helped, he kept on going to massages and using massage gun, even using a therapy shockwave machine that gave him even more pain. So in the end, it gave him more pain. I told him no more than once every 2 weeks because you're already very flexible. You have to understand there are things like warm up stretches and of course loosening through manual techniques, massages, and shockwave therapies. These are things that can very well help, but if done in the correct manner. I hope this was helpful. Again, this is Dr. Joff here at the Cebu Orthopedic Institute, and I hope to see you once again. If you are not part of the Facebook group, we will be discussing the deeper ways on how we can treat your hip and knee arthritis without medicines, without supplements, and without any surgery. And if this is something that you find useful or interested, I want you to, of course, join the Facebook group. It is Hip and Knee Arthritis Philippines. I'll see you. Bye-bye.